So Jim and I will field any questions you may have or comments. Is that right?
Yeah.
Okay, thank you. Thank you very much.
I actually have a few, and I wanted to call on a couple of people for comments as well. But I think one of the things that's, if you think of Jim's comments and then Marc's, what we're talking about at the outset is this convergence of public sector, business, public health, community models. And then much of the discussion that we would have around that, and I'll give the example in the not-for-profit world and or the government world, focuses on the need for more collaboration. This discussion turns on, so how do you effectuate that? Because the real question here is, do we have the right business models in place to execute? And that gets down to some pretty interesting questions and around capital formation. This is. I mean, I was invited to a pretty interesting policy discussion with some leaders around the country on health policy going into the next decade. And one of the biggest discussion in the room was, how do you access venture capital money at this current time? I mean, that's a big deal question. What you then take that question and say, well, how could you do that in the context of a not-for-profit or a business or now a new entity that can benefit from quasi-not-for-profit status, can leverage income in different ways, okay? Really big deal. And as some of the other speakers speak, I hope they can comment, because we have others in the room who are looking at that. And I'm actually going to ask for just a quick response from a couple. This came out of a couple of questions I got up here as I was sitting over there. But Kevin, if you could just very briefly, because I know that in some of your efforts, which you can expound on later, you've been toying with or actually been part of creating an LC3, I think, is part of your business. Okay, and another point I make, and Alan's not here right now from General Electric. He may feed into some of this discussion later, but even Nick, who's about to begin, there's a lot of discussion that we're talking about around the idea of creating, as Nick would call his, an accountable care community or centers of innovation. This discussion allows the leaders who are thinking about that to begin to think about how do we capitalize those efforts in spaces that could connect those systems. Finally, in that regard, I'd like, Elizabeth, maybe you'd want to comment. I mean, Elizabeth comes from Robin Hood to Single Stop and has recently convened a group from, well, I've been involved in it, and some people from Harvard and some other people around the country looking at scale of her model, but also I caught some of the theme here in terms of when and how you use different investments, in terms, including foundation money as a catalyst, as you were saying, Marc, to generate the business investment. So, Elizabeth, do you have a comment or two?
Yeah, I think it's really interesting. I'm sorry, that's so loud. Hi, how are you? I think it's really interesting. I actually was just looking at an article that just came out of HBS a couple of months ago. I don't know if anybody's seen it, which is about for-benefit corporations, which actually technically under the law, I don't think exists as a categorization. I used to do 501c3 law back in my lawyer days. But, you know, the whole concept of sort of like mixed vehicles and whether or not there are different ways to get capital formation or aggregation of capital in different, to different benefit enterprises. I think that, you know, the traditional foundation mechanism, which actually hasn't been utilized particularly, which is PRIs, program-related investments, I think are a decent vehicle, but haven't really been capitalized on. And I think when one looks at social change, one of the real issues is not that there are not good models out there, but there's not an aggregation of capital or a rush of capital towards good models that can really go to scale. So when you look at answers for, let's just say, in the issues of healthcare, when we're looking, at Single Stop, we actually look at sort of breaking down the silos among all the comprehensive issues of benefits and social services that could help families rise up and out of poverty. $750 billion system in this country that essentially doesn't function because it comes down through 28 different systems and then thousands of different nonprofit organizations. And so it's incredibly inefficient, and yet there's billions of dollars flowing into it. When you think about that, you think about structurally, there's so many obvious solutions, and yet you can't really scale them, because there's no way to get the capital flow in a logical way. And I think that's true if you look across anything from early childhood. Like, we know the research is read to your children early, right? But the way the money flows is through certain systems that are already predetermined, and so we can't get the research and the R&D money in early to actually redirect the capital. And I think that there's some potential efforts to look at this. I think healthcare reform, if it goes through and if the new court decision doesn't totally change this, could be a potential catalyst to not just rethinking the organization of healthcare itself, but how other benefit enterprises, let's say systems like food stamps and other major human services, then tail into it because it'll be such a major market move. And then conversely, if there's some potential interesting models that come out of that, I think it could really lead to some potential changes in legislation that can lead to bigger revolutions in how we think through the tax code. I mean, the U.S. and how it thinks through the tax code is fairly reductionist versus other countries and how it thinks. So I think it could be a potentially interesting engine for change. I think we're not, I think it'll, like, the tail will wag the dog. And one of the things that's really cool about a group like this is we could be the tail, and there's going to be a god darn big dog, right? So let's figure out how we kick it in the rear and move it to really, I think, force interesting change at a really critical time for our country when we're in tremendous need for change. And the resources actually may be there if we figure out how to reorganize them. That's just my thought off the top of my head.
We're shortly going to go to the other group, but I wondered if Mark or if you and Jim had any comments or as we wrap this session up.
Thank you. Yeah, a couple of things I want to mention on the subject of availability of program-related investments. When I wrote the first L3C law, less than 1% of the foundations in the United States were making program-related investments for a variety of reasons. As of the end of last year, that was up to in excess of 7%. So we're seeing a significant increase, having to do primarily with the foundations recognizing that as good stewards of the resources entrusted to them, there is an advantage in making an investment as opposed to a grant, which is an expense. The investment remaining as an asset on the foundation's balance sheet to be recovered one day and recycled over and over again, in theory at least, with earnings for social purposes. So there is a multiplier effect in a PRI that doesn't exist in a grant. The other thing on the comment about government action and legislation, there is in fact a bill pending now in the House and Ways Committee called the Philanthropic Facilitation Act, which would greatly facilitate the process by which the IRS would approve investments in L3Cs and other social enterprises. Such approval is not required, but for some foundations will require it as a matter of policy, especially in very large PRIs. And this, if enacted, this bill would allow the L3C to secure approval upon which any number of foundations could then rely, rather than having any number of foundations seek their own private letter rulings, which is the current state of the law. And it would also, in exchange for that, the L3C would report annually on its social progress, which I happen to think is a good thing. So we do see some movement, both in terms of the marketplace and government, both in favor of what I'm describing. Also, in April of this year, the Treasury issued new rules supporting program-related investments, expanding the category of sanctioned fact patterns, allowing specifically for non-U.S. targets, bottom-of-the-pyramid stuff, which we've been doing for a long time, allowing for individual recipients of PRIs, for example, and doing all sorts of other things. And the ruling which came out specifically stated, one, notwithstanding the fact that it was labeled a proposed rule, nevertheless it could be relied upon as good law right now when issued. Number two, most important, it stated that these rules were being promulgated at the specific demand of the foundation community. So they are getting on board, and I think it's a good signal and substantively a very important thing for all of us.
Okay.
So thank you.
All right, thank you.